Okay, ladies, so today I'm going to be meeting with Tasha. Last time I met with her, I did a client intake form. She gave me her informed consent, and she also gave me consent to share this information with the two of you. So let's look at her client intake form. And so she graduated from Dalhousie in 2016. She's currently 26 years old, and she was previously on the varsity soccer team during her time in university, but she now doesn't do soccer anymore. She works full-time as an early childhood educator, and she reports feeling fatigued, losing self-confidence after stopping soccer, and losing motivation to go to work. So she has some strengths that she identified. Overall, she actually really enjoys her job, and she has interest in getting back into soccer, and she has a small group of friends from university that she sees about once a month. So we identified some occupational performance issues. She's unable to participate in soccer due to lack of engagement and pleasure in the sport, and she's showing up to work late more frequently. And so we identified some goals, some of them being by the end of 6 months, Tasha will engage in recreational soccer 2 times a week for a month, and that by the end of 6 months, Tasha will arrive to work on time daily for a full month. So I was thinking about doing the Beck depression inventory as I want to explore further whether or not depression is having an impact on her OPIs. Do you guys mind telling me what you guys have learned in school already about the BDI?
Actually, we just talked over this the other day. Do you mind if I just pull out a few of my notes?
Mm-hmm.
The Beck Depression Inventory is one of the commonly used screening instruments, and it measures for the severity of depression or depressive symptoms. It can be used for both adults and adolescents over the age of 13, and it is administered at the discretion of the healthcare professional. So it's based on their kind of professional suspicion of the client's expression of depressive symptoms. According to Beck, who is the founder of this theory, the current inventory is composed of items relating to depressive symptoms such as hopelessness and irritability, cognition such as guilt or kind of feelings of being punished, and physical symptoms such as fatigue or weight loss or lack of interest in sex. So that's kind of what it's looking for. Our professor also emphasized how important it is to not recognize this as a diagnostic tool that is just used for screening, so kind of to go further after that and provide more tests or whatever kind of path you choose to go down.
Yeah, sounds great. Do you guys know anything about the theories?
So we've actually been studying some theories in class lately. One main one about occupational therapy is the psycho-emotional model, and within that is Beck's theory of cognitive theory, and it kind of just discussed how it's people's own cognition and own thought processes which leads to depression. So people kind of created the cognitive triad, and the cognitive triad actually includes the individual self, future, and world, so how they would view that. And if you're looking at depression, he's saying that the individual would actually view all those 3 concepts negatively. So this would actually relate to the BDI because it's just asking questions about how the person's feeling and how they're thinking.
I'm impressed with your understanding, so I'm going to go meet with Tasha now and we can discuss more about this later. And so while I'm out there, maybe think about some advantages and limitations to the BDI. Okay, Tasha, I'm just going to get you to fill out this questionnaire. It's the BDI, which is the Beck Depression Inventory. So this questionnaire consists of 21 groups of statements. So please read each group of statements carefully and then pick out the one statement in each group that best describes the way you've been feeling during the past 2 weeks, including today. Circle the number beside the statement you have picked. If several statements in the group seem to apply equally well, circle the highest number for that group. Be sure that you do not choose more than one statement for any group. That's including item 16, which is changes in sleeping patterns, or item 18, changes in appetite. Okay, do you have any questions?
Nope, I don't think so.
Okay.
There are a total of 21 items on the BDI. BDI items are self-rated on a 4-point scale from 0 to 3 related to the severity of depression symptoms, where 0 indicates an absence of the symptom and 3 indicates a severe form of the symptom. The BDI typically takes 5 to 10 minutes to complete. It can also be administered verbally by the healthcare professional or paraprofessional, but interpretation must be left up to the healthcare professional.
Loss of interest. I have not lost interest in other people or activities. Or I am less interested. Or have I have lost most of my interest. I definitely think I'm number 3. It's hard to get interested in anything. Loss of energy. Is it I have as much energy as ever? No. I have less energy than I used to have. Yeah. But thinking about it, over the past 2 weeks, I've had pretty decreased energy. So I think I'm gonna go with a 2.
The 21 items featured on the BDI are sadness, pessimism, past failure, loss of pleasure, guilty feelings, punishment feelings, self-dislike, self-criticalness, suicidal thoughts or wishes, crying, agitation, loss of interest, indecisiveness, worthlessness, loss of energy, changes in sleeping pattern, irritability, changes in appetite, concentration difficulty, tiredness or fatigue, and loss of interest in sex. The scores corresponding to the 21 items are added up to give a number between 0 and 63. The scoring is as follows. 0 to 13 indicates minimal depression, 14 to 19 indicates mild depression, 20 to 28 indicates moderate depression, and 29 to 63 indicates severe depression.
Okay, Tasha, so according to the BDI, you were screened to have moderate depressive symptoms.
Okay, what does that mean?
So first of all, this doesn't mean that you were diagnosed with depression. However, it does give us guidelines as to where to go with your treatment plan. Moving forward, this assessment just gives me more information to take into consideration when working towards your goals.
So I said that I wanted to get back into soccer. How does this depression screen relate to that?
So since you reported things like feeling fatigued or having some lack of interest or motivation, those are all factors that we have to consider when we're working towards your goals. So you've mentioned some things that you want to engage back into activities like soccer, and so we can make sure that we take those into consideration when we're getting you back to things that you enjoy doing.
Okay, that makes sense. I'm also having problems not getting to work in the morning. I just find it I find myself unmotivated to get out of bed in the morning. How do you think I'm supposed to overcome this?
So I was thinking the next time that we meet, we can work on addressing some strategies on how you can get to work on time and perform your best at work. And in addition to OT, I was thinking it may be a good idea to maybe see another healthcare professional. They can maybe properly diagnose the potential depression. Does that sound okay with you?
Yeah, that sounds okay.
Oh, so it looks like you guys have come up with quite a bit there. So I just finished up with Tasha. We did the BDI scale. Her score came in the range of moderate depression. And once again, we want to remember that this is not a diagnosis. So why don't you guys explain to me what you guys came up with?
Okay, perfect. So we discussed a bit about advantages, and from our understanding so far, the BDI is a great screening tool with the ability to discriminate between multiple symptoms of depression, helping us apply evidence-based practice as occupational therapists. This tool can be quite helpful throughout therapy by allowing OTs to acknowledge potential emotional challenges that might be faced by their clients that can interfere with reaching their occupational goals. I took note from one of our class readings that the BDI takes into consideration modern criteria for the diagnosis of depression and incorporates evolved psychometric techniques. So this makes it widely acceptable within our OT field. As a student, I can definitely appreciate that this test is user-friendly and that while I am not qualified to interpret the results, I would be able to administer the test. It also helps when we felt it was important to point out that scoring can be done manually, but also by web-based and via desktop scoring.
Okay, and for the limitations, because this assessment is subjective and takes on a self-report method of administration, we're relying on patient honesty and have to realize that there's potential for inaccurate results that may not reflect the individual if they have ulterior motives. A few other concerns we found in the research is that under or over-reporting along with false positives are sometimes observed, and difficulties are sometimes present in regard to response differentiation and format. We also need to remember not to treat the BDI as a diagnostic tool. For us as OTs, we need to recognize that the BDI screening tool is not individualized and therefore does not have any questions relating to occupation that are identified as meaningful to the client.
So that sounds great. Do you mind telling me a little bit more about that cognitive theory?
Yeah, sure. So me and Brenna were actually talking about cognitive theory again when we brought it up earlier. And we just wanted to talk a little bit about how it's actually impacting the interpretation of the assessment. So where it's looking at the cognition, and especially Beck's cognitive triad, we're kind of just looking at how these initial thought process and initial signs and symptoms are actually what causes depression rather than depression leading to these signs and symptoms.
So in summary, the BDI is a really quick and efficient screening tool that you can use when you suspect that your client may have depressive symptoms that would be impacting their ability to engage in meaningful occupations.